The Trump administration tonight is saying it's canceling a nearly $800 million vaccine contract. Moderna says HHS, the health agency, withdrew money that was supposed to help pay for the development of a shot to protect people against different flu viruses that could cause pandemics, including the bird flu. Remember, bird flu, a lot of concern lately, spreading from birds to cattle. It's infected at least 70 people. Some scientists are worried that if the virus keeps mutating, it might turn into something that spreads more easily and could possibly, not to alarm you, but maybe turn into a pandemic. The HHS, in a statement to us, says continued investment in Moderna's H5N1 vaccine was not scientifically or ethically justifiable. I want to bring in Dr. Kavita Patel, who's joining us now here in D.C. It's good to see you. Why not? Why is it not? Why would it not be scientifically or ethically justifiable?
Yeah, they're pointing criticism at the technology that underlies the Moderna vaccine, which is messenger RNA technology.
This is mRNA. We remember it from the COVID days.
Exactly,
yeah.
And that's exactly where we saw it kind of explode. Research around mRNA vaccines have existed for about 30 years, so this isn't truly that new. It is new in the way we used it for COVID, but the administration has said that this is unjustifiable. It's not clear why they say that, because we do have a track record of using it for not just other vaccines, but for lots of different therapeutics.
Well, so that's the next question that I think somebody listening to this would ask, which is, okay, well, should we be worried?
I think what we
scientifically, from a scientific perspective.
No, but we should be worried about making sure we're on top of whatever we need for the next pandemic. Okay. And I think that's where a lot of us have raised concerns. If you're going to take this away, what are you putting in place? Are you going to have another alternative to kind of research more up-to-date strain-specific bird flu vaccines? Because that problem is not going away. So what are we going to put in its place? And we don't have answers for that.
What are we going to do about the bird flu?
Right. So we do have, here's the good news.
Yeah.
There are existing bird flu vaccines. They're not 100% effective against this current strain, which is why that research was necessary.
Okay.
But the United States and other governments have stockpiles so that if we were to get to a point of a pandemic, we would have something that would help us. But I'm really hoping we don't get there. We're all kind of hoping that we don't see it. None of us want another pandemic. And certainly we would love to see better vaccine development, not just for bird flu, but you mentioned flu viruses of different kinds.
Even the P word, I think, in the context of this can feel alarming to people, and we do not want to be alarmist, right? Talk through that, because, again, the spread from bird to cattle was a concerning one.
Right.
There are, like we said, dozens of people, human beings, who have gotten it, but it's not exploded.
It is not. We do not have cases of human-to-human transmission. That's what we've been watching closely for. Any human case we have, we're trying to figure out how they got it, and we can trace, in almost all those cases, trace how they got the bird flu.
And the reason that's important is because human-to-human transmission would suggest that it has mutated enough to spread among people.
And that's exactly kind of why we worry about these viruses. They're easy to give and get once they go human to human.
Going back to this issue of Moderna and the Trump vaccine, sort of pulling the research funding for that, what would be next for Moderna here? Do we know?
Yeah, so it's interesting. I think Moderna's put out some statements that this obviously pauses their work, but could they, as a public company, do something different? They also have 2 other vaccines up in front of the FDA, not related to the bird flu, but COVID and RSV virus. So this is a company that has had a track record of doing vaccines. To be determined on whether they take this through. It's hard to see how you do it, though, when one of the world's biggest customers, the United States government, pulls a contract.
Dr. Kavita Patel, good to see you, as always. Thanks for being here.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.